Good evening, everyone. In today's video, I would like to talk about a patient chart, the components of a patient chart. To know about the components of a patient chart is very important for any healthcare provider, whether he or she be a pharmacist or a nurse or a doctor or other healthcare provider like dietitian or occupational therapist or physical therapist, something like that. But the way our educational system is throughout the world is that oftentimes we finish our education without even before seeing a patient chart. I remember a story when I was doing my consultant pharmacist initial course for getting the consultant pharmacist licensure. The instructor was telling a story where he was talking about the rules and regulation of a patient chart, and there was a pharmacist in his course in that session who used to be a retail pharmacist, and he said, I never saw a patient chart. I don't know what you're talking about. So I'm making this video so that if someone is like that never saw a patient chart, that person can be familiar with this thing, the patient chart, and make some sense when something is being talked to him or her about patients therapy or management of patients therapy or in any facility. Then they can make some rationale what is being talked about. So please subscribe to the channel as I continue to make important videos like this for you guys. So please subscribe. I'm not seeing much people subscribing to the channel, even though I see many people are watching the videos. So please subscribe to the channel so that the channel can grow. Because of the introduction of electronic order entry system and electronic format of writing progress note by the physicians, and also other things from the nurses that are documented electronically, nowadays the use of patient chart has become much less than it used to be before. But that doesn't mean that the patient charts use has been totally gone. It's because there is still some paperwork that need to be done when the patient are in the hospital. So those paperwork need to be kept in the patient chart. So patient charts are still alive, they are still being used, but not in the way or not in that big amount of use that it used to have before. And this is particularly true for small hospitals or for long-term acute care hospitals or nursing homes, assisted living facilities, or those hospitals where the electronic system of management of patient chart is not introduced yet. Still they use the patient charts as their sole source of recording or keeping the patient's record. And after a patient is discharged, this patient record is actually goes from the patient chart to a record that they kept, which is kept under the patient record management system. So this patient chart, after a patient is discharged, the whole thing gets piled up and kept for years based on the institution's policy, how long they keep it, and they keep it there as a secured way. Throughout the world also, the patient chart is used mainly in the hospital because most of the world is not still under the electronic management of patient charts. This is how a patient chart looks, and it can be of any color. This particular one is red because cardiovascular intensive care unit oftentimes prefers their charts to be in red color, and sometimes this chart can be very thick and one chart may not be able to hold all the documents or papers. In that case, we extend the chart into 2 or 3 charts as needed. In that case, we name those chart as 1 of 2, 2 of 2, like that. These are the components of a patient chart. The first section is discharge, where any information that is related to patient discharged and those information that will be given to the patient after they get discharged will be kept there. Then the physician's order section will have all the physician's order that is written by the doctors for the patient with date and time. These orders can be orders for medicines or labs or any order related to patient care. And then the next section is progress notes, where the notes written by the physicians daily, those are kept in that area. And then the next one is graphic chart, where all the pictures and graphs are gonna be kept there. And then the next one is H&P, history and physical, where the patient's history from this admission or previous admission or from other institutions can be kept there. Then the consults the patient has for the patient care, and then the consent and operations procedures, where if the patient goes for any operation and procedure, they need to give the consents, so those consents are kept there. And also the notes from the patient's operations and procedures are also kept there. In the laboratory section, the labs that are done for the patients are kept there. Then there is a section for pathology, and then the next section is diagnostic imaging, where all the imaging that is done for the diagnosis purposes will be kept there. Then there is a section for cardiology. In that section you may find the ECG that are done for the patients and or other tests from cardiological point of view. The section for medications would keep the patient's MAR, medication administration record. Then there is section for neurology, then physical therapy notes, then occupational and speech therapy notes, then notes for respiratory therapy, and then notes from the nutritionist. And then there's a place for advanced directive, which is basically who can take the patient's decision when the patient cannot give the decision on his own. This is very important from a legal point of view, so the documents related to advanced directive are kept in that section. Then there is a section for keeping patient's record related to telemetry. Then there is a section for patient education, which will contain the education or teachings that were given to the patient for taking care of their conditions or disease or how to take the medicines. And then there's a section for nursing note, where the nurses will keep the important notes that were taken for the patient while they are taking care of the patients. And then there's a section for miscellaneous, which if something is not under these tabs but may be important for the patient are kept in that miscellaneous section. So please subscribe to the channel. I hope to see you guys again next time. Thank you.